So you all did an incredible job of distilling how many hours of conversation? It was a couple. No, it was an hour. Yeah. So you did an amazing job. And you all participated in each one of these conversations. So are there things that you would like to add? Maybe you recognize and you want to accentuate. Maybe you don't quite recognize something that emerged that's been reported out. I wanted to make sure that we had an opportunity to have some conversation about not just what you heard, but what the process was like in terms of being forced to think through ultimately developing strategies at each level so that we could really make some change.
This is really a question that perhaps I don't understand, is that are we going to shape these strategies, and there are many excellent strategies here, around assessment, the utility of assessment as a change agent in and of itself, because I think there's a desperate need for that. And I don't think that piece appears anywhere in the literature. And it seems to me that the richness of the discussion here could really shape that in a wonderful way. Or are we going to use it more broadly to talk about change towards interprofessional education? Or I guess they're not mutually exclusive. It could be a both. But the problem with the both, it seems to me, is that it dilutes the issue around assessment. And so my suggestion would be that we take these great ideas, some of which are directly related to the impact of assessment, some of which could be, and some of which perhaps cannot be easily sort of changed. So that I need some direction from you as to what the sort of ultimate product of this is going to look like.
It's an excellent question. It's actually a question, I think, for the group. So I would also like to hear others' response to that. Mm-hmm.
I think for me, what emerged was if we just started assessing now, we'd be assessing the wrong thing. And I think it really sort of evolved into the opportunities for change and how we might need to look at things differently. And so, and the other part that really came out is, do we have to have the evidence before we innovate? And can we perhaps assess as we innovate? Like, for example, the student learning, we have opportunities for reflective praxis and that kind of thing. So can we think about different ways to assess as we move forward rather than falling back and assessing what is? To me, it just seemed like the groups wanted to explore where we could go and then think about how we would assess rather than creating assessment for where we are. That was just a reflection from my experience.
Carol?
And I'll follow up to that because I think it's a critical point that you're making, Patricia. For some reason, it is on. When we ran the Macy conference in January, which was more policy directed, and came up with a similar set of overlapping sort of strategies as we have here, we studiously avoided the issue of assessment. So from that conference, there's a big gap because although assessment was discussed as, the 800-pound elephant in the room, we didn't really have the right people around the table to have a truly informed discussion. And here you have many more of the right people for that informed discussion. So I just would hate to see this being, I don't want to, repetitive is not the right word because there's some unique ideas here, but sort of another piece of that rolling out and not a strict attention to assessment. And that's really why I raised the question.
So I sometimes follow directions, which is why I focused on our meso strategy, but we probably had at least as much discussion on the macro one, which was to try to use multiple associations to do a joint proposal across professions for funding for multi-site research that would look at some specific approaches to learning. And the example we had was from Pam Jeffries of the National Simulation Study that was done in nursing that examined the impact of high-dose simulation on the learners, on the program outcomes, and now you're going to go on to patient outcomes. Is that right? And a lot of us thought that that's what we need about other approaches in IPE. It's very hard to get that kind of funding. It's very hard to convince multiple associations to do research together, much less multiple professions across associations. But it might be something that some of us could galvanize together. And I agree with Pat that we're early in this, so we really have to be very focused about which approach we would look at. For my mind, I think that looking at some aspect of simulation and the impact is key because it's such an important tool for us right now in interprofessional learning.
If I could just come back, one of the discussions, we didn't have it because it was more at the meso level, but we do have a lot of tools, like with Team Steps. We have a lot of material that's out there that hasn't been necessarily leveraged in higher education in terms of assessment, whether it's patient safety, whether it's Team Steps, whether it's social and emotional intelligence, having to get with that whole area of communication. And so part of our discussion, but was more at the meso level, is leveraging what is there in terms of assessment rather than trying to recreate something new, because many of us felt that there was already, and people brought examples forward of stuff that's already out there. I think that we need to look beyond what we would historically have used, because I think there are examples. We're just not looking perhaps far and wide, because until we get clarity about what we're looking for, we don't see it. And I think that was part of what, to me, has happened during this process. I don't know if that answers your question, Malcolm.
I will say that I love the question. I think it's one that we need to keep thinking about. I mean, it really wasn't an idea that had really consolidated in my own mind about the use of assessment as a change agent until I also sat here and absorbed all of the different conversations and so forth. So I don't want to lose sight of that. Too often I think assessment is thought of as a way of just looking back to what we did as opposed to how to move forward. And so that there is a real role in assessment in moving innovation forward. And I think that we do have the right people here, and I hope that we don't lose sight of that question.
Malcolm, can I ask you a question? So the third bullet that Meg showed was this group coming out with a statement basically empowering the importance of involving patients in the assessment process. To my knowledge, that doesn't exist. And I can tell you, I work in several sectors where there's tremendous skepticism still about involving them. And I would think that could be a pretty powerful policy statement that if all the disciplines in this room said like that absolutely has to be part of assessment moving forward, it's not the how necessarily, but basically saying the what and the why, to me would be a relatively big deal and sends a powerful message. How does that resonate with you?
Wonderfully. I mean, I think that and several other elements here are unique or have some unique attributes. And that's one of them. I think that would be somewhere close to the top of my list if I prioritized these. I mean, without that, we're not going to get anywhere. And that is using assessment, the patient's input to assessment, but assessment in more general terms, as a change agent. And I think it would be well received by the patient community. It certainly, I think, would be well received in the VA as a health system. And we're beginning to sort of move in that direction anyway, and I think other health systems need to collect that information. So I would put my red dot, Eric, on that idea.
Afaf, I'm going to have one more question, and then we've actually already started to shift into the next section. So I'm going to hand this over to Eric in a minute, but I want to hear from Afaf.
Just in response to including patients, there are models. The magnet review credentialing does not happen unless patients are involved in the assessment of the organization. So I think that we're not going to start from scratch again in that. I think it's really an important recommendation, but I would just add to it, use existing best practices to develop for others.
Absolutely. Thank you. Thank you very much.
One other component that I wanted to share, we had conversations around the 360 format. of assessment, and not only just using it and having everyone involved in it, but taking that information as a formative component so that we're really continuing to evolve and make changes in the program. So assessment, I think, is critical, but not just in isolation, but as a part of continuing to develop the programs so that they're appropriate. And having students certainly as a part of that process is very important.
Well, thank you. Fellow members of the Planning Committee, I thank you very much, and I'm going to hand this over to Eric.